Welcome today. I'm Dr. Nicole Smith the founder of Antigravity Wellness. I specialize in perimenopause and menopause care of women. And today I wanted to talk a little bit more about the hormonal changes that you can see in perimenopause and menopause. I often have clients come in who are very confused about why they're feeling the way that they are, why they're having so many issues, and then their primary doctor is really not helping them. And we can find the reasons in their labs. So there are some companies out there that will just prescribe hormone replacement based on symptoms. From what I have seen in the research and the trainings that I've been through with other professionals who've been doing this longer than me, I don't believe that is the safest route to go. I don't believe that's safe care. I believe that we should test, not guess. So we do full functional testing at Antigravity Wellness. And the reason is because then we can see what is going on underneath the hood that can be, oh, well, this is probably why you're feeling this way. Very common. This is low, and that causes these symptoms, and that's what you're complaining of. So let's go after that and see if we can improve your symptoms. So it's an investigative process to figure out what is going on underneath there. This is going to be a very high level discussion about those hormonal changes. I won't get into too much of the weeds with you guys because it can get kind of confusing. But honestly, once you get the basics down, it's not that hard. It's not that difficult to understand what's going on with your body and why it's acting the way that it is and how we can go about treating that and reversing these things and making you as healthy as possible. All right, so let's go ahead and get into it here. So we're going to start off with a little story, maybe, if my slides will work. And they don't want to work, and I don't know why. Got it. Okay. So we're going to start off with a quick little story. We're going to call this a personal journey through the hormonal maze. And our character, we'll call her Sarah. She's a 45-year-old mother of two who was always active and full of energy. She loved running marathons and was known for her infectious enthusiasm. But recently, she started noticing some unsettling changes. Her once regular menstrual cycles became erratic, leaving her puzzled and concerned. Sarah found herself waking up in the middle of the night, drenched in sweat with her heart racing. The hot flashes during the day were just as intense, making it hard to concentrate at work. Mood swings were another unexpected visitor. She felt irritable and emotional over things that never bothered her before. Her energy levels dropped and she started gaining weight despite maintaining her usual exercise routine. Super common. Sarah felt like she was losing control of her body and didn't know where to turn for answers. One day, Sarah decided to share her struggles with her close friend, who was also a healthcare professional. Her friend listened patiently and then explained that Sarah was likely experiencing perimenopause, the transition leading up to menopause. She described the hormonal changes that occur during this time and how they could cause symptoms that Sarah was facing. Armed with this new understanding, Sarah felt a sense of relief. She wasn't alone or going crazy. There was a scientific reason behind what she was experiencing. Her friend suggested some lifestyle changes, like adjusting her diet, incorporating different types of exercise, and exploring stress management techniques. Sarah also considered consulting a specialist about hormone replacement therapy. This newfound knowledge empowered Sarah to take control of her health. She started making small, manageable changes and noticed improvements in her symptoms. Sarah's journey through perimenopause became less of a mystery and more of an opportunity to learn about her body and take proactive steps towards her well-being. Today, I want to share with you some valuable insights that help Sarah. By understanding the hormonal changes during perimenopause and menopause, you too can navigate this phase of life with confidence and empowerment. Let's dive into the science behind these changes and discover practical ways to manage your symptoms. So, what is perimenopause? It is the transitional period leading up to menopause. Typically starts in the late 30s, sometimes 35, sometimes even earlier, though, and can even start in the 40s, but it can vary quite widely. And one of the things that is impacting how different this is from woman to woman. One of them is genetics. So look at your mom and see, or your grandma, and see when they started perimenopause or menopause. But also look at our environmental factors. So if you are really stressed out chronically, if you are eating a poor standard American diet, if you are not exercising, if you're carrying excess body fat, if you have thyroid, gut, adrenal issues, any of these things can contribute to having a worse transition through perimenopause and into menopause. It'll make your symptoms worse. And this makes sense when you think about it from an evolutionary standpoint, where your body is going to preferentially take resources away from reproductive organs, such as the ovaries, and shuttle it into other areas when it's under stress all the time. And we are under stress all the time. Eating a poor diet is adding stress. Not exercising is adding stress. Uh, not getting the stress relief that we need, not getting the sleep that we need, not managing our stress very well, the increased in anxiety, the increased addiction to screen times. These things are all contributing to that stress that's adding on the body that will make those symptoms worse through perimenopause and menopause. And it can also make it start earlier. Symptoms can last for several years, anywhere from 4 all the way up to 10 years. It just kind of depends. And they can kind of come and go. So let's see that, you start noticing symptoms. Like for me, I noticed when I was 37, I started having symptoms that were different. I'm like, something is going on. And so dove in deeper, had to go to a naturopath to really get some good answers because my primary and my OB/GYN were not very helpful, as is the typical story there. And so we dove in, found that I was having some adrenal issues, having some thyroid issues, and that was affecting my sex hormones. So we addressed those root cause issues, and it's still a process. Like I've gotten better, but then I've also had times where I've slid back a little bit. So it can ebb and flow, and I've seen that with my clients as well. When we're on point with everything and taking really good care of ourselves, we feel great. But when life happens and things start to slide back, then we need to course correct because those symptoms start to come back. The key hormones that are involved in perimenopause are estrogen, which is the primary female sex hormone. Very familiar with that. I'm sure most people have heard about estrogen. And then progesterone, which works with estrogen to regulate the menstrual cycle, helps keep a baby to term. If we don't have enough progesterone, miscarriages become more prominent. And it also has a lot to do with when we're going through that perimenopause phase of why the menstrual cycle starts to become irregular. The progesterone levels are changing. And then testosterone is present in small amounts, smaller than males. But however, it's still testosterone levels are higher than estrogen levels in females. Didn't know that, right? But we're still significantly lower than men, which is why we can't bulk up with a lot of muscle like men can unless you're taking some type of, external testosterone or other type of anabolic steroids. So don't worry about that because it's not possible. Also affects libido and energy, becomes very important as we get older. As these levels start to drop, we'll start to be symptomatic. So doing things to preserve our testosterone levels, estrogen levels, progesterone levels, they will naturally drop, but we still have an optimal range even in menopause. And we'll talk about that. All right, so there's fluctuations in estrogen and progesterone levels as we go through perimenopause. Estrogen levels can spike and then drop unpredictably. So we could have estrogen dominant symptoms and then all of a sudden no estrogen. So when we don't have enough estrogen, things start to dry up. So think about everything drying up. Your skin dries up, your libido dries up, your vaginal tissues, they dry up. All of these things start to just kind of go downhill. And then the elasticity in your skin goes down, and the protective factors of estrogen also go down. It protects your heart, protects your brain, protects your colon. And as that starts to go down and protects your bones, as that starts to go down, that protection starts to go down as well. The decrease in progesterone leads to irregular periods and a heavier menstrual bleeding. So I have that complaint a lot that ladies come in, they say, my menstrual cycle is irregular and I'm noticing that I'm having heavier bleeding. So as the progesterone levels drop, that creates basically a high estrogen situation where the estrogen isn't necessarily high, it's still within a normal range, but in relation to progesterone, now you have estrogen dominance. So you're going to have symptoms of that as the progesterone starts to drop. And there's things that we can do to help support the body. We can use things like Vitex can help to naturally increase progesterone production, which is very potent. So you don't just take that. You need to have your levels checked and then monitored before you take herbal supplements, even because they can be very, very potent. Or we can even just give you progesterone to help with those levels to just kind of even you out while you're going through the transition. Symptoms of perimenopause. This is a very short list. There are a lot more symptoms that we're learning about, but starting off with irregular periods. Some women can experience hot flashes and night sweats, not everyone, and everyone's a little bit different in their severity and the combination of symptoms that they may or may not have. Mood swings and irritability are very common, sleep disturbances, and then weight gain and slowed metabolism. Weight gain, especially around the belly. As those estrogen levels drop, the testosterone kind of kicks in a little bit more, as far as, again, that relationship. Not that the testosterone levels are getting higher, but they are in relation to estrogen now higher, will have more of an impact on where you store that body fat. And that tends to be more of a male dominated type of situation where it will accumulate in the center. So, transition to menopause. Menopause is defined as 12 consecutive months without a menstrual period. It has to be exactly 12 months. So, the average age of onset 51, 52, 53, somewhere around there. You can go into it early, you can go into it late. Again, some genetics have something to do with that. And then there's also surgical menopause, when the uterus and or ovaries are removed. Even if the ovaries were spared, that usually kicks you into an earlier menopause because of the trauma to the area. Perimenopause transitions into menopause once menstruation ceases. So we're in perimenopause up to that point, and then we cross that threshold, and now you're in menopause and then postmenopause. So there's many different phases to this. And the hormonal changes during menopause, there's significant decline in estrogen and progesterone production. Estrogen levels tend to stabilize at a low level. However, we don't want them at zero. Okay. We should have still a little bit of estrogen floating around. And that's why testing is so important and watching symptoms, the combination of those two things. We want to make sure that the woman is still feeling as optimized as possible and her levels are within that optimized range going into menopause, because having bottomed out zero estrogen is really, really bad for your long term health. It will shorten your lifespan and make your quality of life go down. The impact in the body systems, reproductive. Obviously, we stop menstruating, their reproductive years are over. Cardiovascular health, again, estrogen as it drops will affect that protective factor that it had on the vascular system, on your heart and your brain. That protective factor starts to go away as it goes away. So the risk of heart disease and stroke goes up in menopause, and that is why, because our estrogen levels are dropping. And then our skeletal health, our bone health. Estrogen plays a really key role in bone turnover. So our bones are constantly being broken down and built back up again. But as we get older, the rate of breakdown starts to exceed the rate of build up. So it's like your savings account, right? And you retire and then you start withdrawing from that. If we're not maintaining that bank, now with retirement, it's a little different. We intend to like take it all out. But with our bones, we want to preserve as much as we possibly can. So we want to continually be redepositing those essential nutrients like calcium, magnesium, and things like that back into our bones. And estrogen plays a really key role in the infrastructure of the bones. So the tensile strength. So when you fall, it doesn't crack easily. So there's a lot that goes into that beyond just drinking more milk. So symptoms of menopause, continuation of perimenopause symptoms, and then often they become more intense. So those same symptoms typically continue, and then they get more intense as you're going through that menopause period. When you first transition, after 5 to 10 years or so, it can be a while. Again, that range, those symptoms tend to even out, and then women feel fine, and then they're just in postmenopause, and that's how they are. Vaginal dryness and discomfort are very, very, very common. That's one of the main complaints. And there's lots of things that we can do for that include not just hormonal therapy, but also other types of modalities and a holistic approach to it to help the woman to have a better experience with the rest of her life, which a lot of us are living older, and to just throw in the towel and think that the last part of our life is going to be miserable. Well, I'm not willing to do that, and a lot of my clients aren't either. So I don't think we need to put up with that. There's an increased risk of osteoporosis and cardiovascular disease, as we keep on harping on, and memory issues and difficulty concentrating. That's also because of the hormonal changes that are happening. And then, of course, aging. I can't say the word right, but the combination of inflammation and aging at the same time, there's that speed up that can happen. So the more inflammation that we've had, the longer that we've had that inflammation, poor diet, lack of exercise, excess body fat, uncontrolled chronic health conditions like high blood pressure, thyroid disorder, things like that. Those things will contribute to exposure, smoke, things like that, will contribute to chronic inflammation, which will make you age faster. So, another case to go after that, those causes of inflammation, to stop and even reverse those processes. The body wants to heal itself. You just got to give it the environment to do so. And then the impact on overall health: bone density loss leading to osteoporosis, increased risk of heart disease, changes in skin elasticity and moisture, as we talked about as well. And then mental health considerations: increased risk of depression and anxiety. And that actually goes along with those hormonal changes. If we can help support the woman through that, their symptoms such as these will improve. So instead of throwing an antidepressant at somebody when they come in that perimenopause and menopause range, what if we looked at the whole system, looked at their labs, looked at their sex hormones, and went, you're running low on estrogen, your progesterone is low, your testosterone is low, everything's in the gutter. No wonder why you feel the way that you do. Let's support that and see if we can make a change here, as opposed to just covering up the symptoms and then letting everything else fall to the wayside. It's not going to get better on an antidepressant, these hormonal changes. So managing symptoms: lifestyle changes, diet, exercise, and sleep, key. Has to be the foundation of everything that we do. We can give you all the medication and the hormone replacement in the world. If you are not addressing these foundational items, you're on a foundation that's going to crumble. And so all of the band-aids in the world, all the duct tape in the world will not keep that foundation together as it's crumbling beneath you. You must address these things. It is a non-negotiable. Hormone replacement therapy can be very, very beneficial for some people. And it's if you are interested in more on that, I recommend the book Estrogen First. It is, and I'll actually put the link in the comments when I'm done with the live here. Or Estrogen Matters, sorry. Estrogen Matters. It's by a couple of PhD and MD doctors who really dive into the research behind estrogen and why it's actually like what we thought, that it causes, linked to breast cancer and everything. That's actually not panning out at all. And even when we look back at the study of the Women's Health Initiative, where we initially thought that was what was going on, we see that things were actually taken out of context. They were sensationalized in the media. Get on that. And so those statements were not actually fully proven before they were posted. And so it created a lot of fear mongering and things that are just, we're finding that's just not true. And it was actually very detrimental to women's health at that time, as all these women came off of their hormone replacement and they actually shortened their lifespans significantly. So that's a really good book to go look at and read about. And then just like staying up on more of the research that's coming out, which I'm going to start, bringing more of those types of research studies up with you guys too, because I want you to be informed. And that's the number one thing I think that everyone, that's why I say be your own advocate and take charge of your health. being your own advocate is all about, first and foremost, being as informed as possible, which I know is very difficult when it comes to medicine because it is a foreign language and it can get very complicated very quickly. So I'm trying my best to distill all this information down to give it to you so that it is easier to understand. And you can then make that joint decision with your healthcare team of what you want to do for your health and your body. Because I do believe in patient autonomy. I think that it is your right to decide how you want to proceed. So, if you wanted to talk about hormone replacement and maybe try that and see if it helps you, I think that's great. If you do not want to try that and that's something that, you're not interested in, that's fine too. So, and then there's alternative therapies, like I was talking about. There's phytoestrogens, acupuncture, herbal supplements. But it's very important, again, like the herbal supplements, for example, such as Vitex, chase tree berry, which is for typically used in those perimenopause, menopause supplements. It can be very potent to increase progesterone levels, and then you can get too high. So it's very important that you're being monitored closely by someone who knows what you're taking, is watching your lab levels, and is watching your symptoms to make sure that we're not having any side effects that we don't want and causing issues when we're trying to fix something and then causing another problem, right? All right, so recap real quick. We talked about perimenopause and menopause. So, perimenopause, that time before menopause, can last up to 10 years, usually starts late 30s, early 40s or so for some people. And the menopause, 12 months without a period, and then you have crossed that threshold. The hormonal changes that happen, progesterone, estrogen, and then testosterone as well, everything kind of fluctuates and then it all goes down as we go through menopause. The symptoms that can result from that, the health implications, heart health, bone health, gut health, brain health, and then management strategies, lifestyle, hormone replacement, and then alternative therapies as well. So, proactive steps for you to take, regular checkups with your doctor. If your doctor, even if your doctor isn't going to manage hormone replacement and that's something you're interested in, it's still very important for you to follow up with your regular primary care or OB/GYN to make sure you're getting your regular health screenings, the breast cancer screenings, the colon cancer screenings, the heart health screenings. If you have any lung issues, these things are very, very important to make sure that, because, like breast cancer nowadays, it's not a death diagnosis. The rate of survival and recovery from that is very high, but we need to catch it early. So if you get your screenings on a regular basis and we can catch these things early, there's a lot that we can do to quickly get on top of it, and you will live a very happy, long life, that's healthy as opposed to, dying before your time. Lifestyle choices, healthy lifestyle choices, again, foundation. Without that, everything else crumbles. Symptom management, mental and emotional health of the person who's going through this process, it can really take a toll. So again, we don't want to just throw an antidepressant at this. We want to see what is going on. If we need an antidepressant while we're working on the underlying causes, 1,000%, let's do that because we want to make sure the person's safe, right? But we try and get them to a place where we're managing the symptoms in a more natural way, or addressing those underlying causes. And then utilizing available resources. I'm a resource here. I am going to be constantly putting out more information for perimenopause and menopause women. I think this is an area of huge need. And I've had that feedback from my clients and from people who've watched me on social media, and from myself, from my own personal experience going through this. There's not enough being said about this. And there's a lot of bias in medicine, and in the research. So the more that us women stand up and say, we deserve equal care, we deserve to have um, our things studied and to understand how things affect us more so that we can make better decisions about our healthcare. It's just so important. So I'm part of that movement, and I hope that you join me in that. All right. Thank you so much for joining me. I'm going to check the board. Okay. And remember, during these live streams, if you are on here, you can absolutely ask a question, or if you're watching the replay, please do come in, like, comment, share with anyone else you think would benefit from this. Ask me any questions that you might have, any clarification, any other things you want me to cover. I'm here to serve you. I'm here to help educate you so you can make better decisions about your health and your wellness. And even men out there, if you have a wife who is going through perimenopause or menopause and you need help to help her, this is the place for you as well. So thank you so much for joining me. You can check out more at antigravitywellness.com. I will be having some new things coming out towards the end of this month, so stay tuned for that. And I intend to go live again tomorrow around this time. My schedule is kind of fluctuating, so I'm doing the best I can. And then you can also catch the replay of this on Spotify. I will be posting this as a podcast. So thank you so much for joining me and have a great rest of your day.